In the previous video, you learned about key results of scientific studies related to sPLA2-llA. But there have also been many clinical studies that have been published in peer-reviewed journals. A few key publications are highlighted here. In the first study, researchers looked at whether the risk of recurrent cardiovascular events is associated with sPLA2-llA levels in 1,024 patients with coronary heart disease. After measuring plasma concentrations of sPLA2-llA mass at baseline, they determined that sPLA2-llA mass was associated with an 80% increased risk for cardiovascular disease events. In another study, researchers compared available measurements of sPLA2-llA mass, or Lp(PLA2) mass at baseline, and again after 16 weeks in 3,086 patients who had unstable angina or non-Q-wave acute myocardial infarction. Here they found that sPLA2-llA was superior for identifying patients who were at increased risk of cardiovascular death. Some other studies include the association between sPLA2-llA and prognosis in 964 patients post-acute myocardial infarction. After measuring sPLA2-llA from serum samples, the patients were divided into two groups based on the levels of sPLA2-llA. During a median follow-up of about 4 years, 52 patients were classified in the all-cause mortality group. 31 patients suffered a non-fatal myocardial infarction, and 40 patients were readmitted to the hospital for heart failure. What's most notable here is that a higher level of sPLA2-llA was associated with a significantly higher prevalence of death in the first study listed here. In a fourth study, researchers examined whether sPLA2-llA levels may provide significant risk and prognostic values in patients who have coronary artery disease. Here they evaluated 147 patients who had organic stenosis that was more than 70% of at least one major coronary artery. What's most interesting is that only higher levels of sPLA2-llA were a significant predictor of coronary events, independent of all of the traditional risk factors that were measured in the second study listed here. Clearly, the results of these studies validate that the measurement of sPLA2-llA can be very useful to assess cardiovascular risk independently from conventional biomarkers. Watch video 3 to learn about the benefits of measuring sPLA2-llA with the AccuCardia test system.